years. As you can see, the problems in our healthcare delivery and finance systems are so complex they can't be solved without action on at least 3 governmental levels and even private levels within each health system. We need local, state, and national change. The issues of accessibility of healthcare and affordability of coverage, especially for those with the greatest need, should be addressed on the state level. Health industry is governed by state law. The health insurance industry is governed by state law and regulated by state agencies like our insurance commissioner and the Department of Community Health. Medicaid is a state program with federal funding. So while we wait for a federal plan, as Marcia said, we feel there are things we can do on the state level and that we should do now. So we're proposing 3 things today and ask your commitments as legislators to all 3. And you'll find on the left side of your packets our 3 asks, but I'm going to go through them briefly. First, because the problems are so complex and so important to our health and our economic recovery, we ask you to create a bipartisan healthcare caucus in the Michigan House of Representatives. We need to get beyond partisan politics and ideological arguments and look at what is practical to do together. Some might say this is our most naive ask of the group, but we're at a point in our history now where I think this state is desperate for change on health care. People are losing their jobs, losing their coverage, and we need both parties to work together to come to a solution. We have 2 possible solutions that will help in the interim. Our second ask is, since healthcare resources are not distributed evenly throughout the state, they're in fact scarce in rural and urban neighborhoods. There are places in Michigan where if a local hospital closed, there wouldn't be a hospital for 70 miles. When Riverview Hospital closed, I think it was last year or maybe a little longer, in Detroit, Moses, Michigan Legal Services got together with the Detroit-Wayne County Health Authority, and then the Health Authority carried the ball and did a great job putting together a plan to replace the services that were abandoned, if you will, when Riverview closed. There is a piece of legislation in Massachusetts called the Essential Services Act, and there's a summary of it in your on the left side of your folder. We would like Michigan to establish a similar essential services law. That way, in areas that are underserved medically, which in this state include lots of rural areas and almost every urban area, if a hospital decides it needs to close, there would be a process whereby we could determine what services are essential and how to replace those services after the hospital leaves. So an already underserved neighborhood wouldn't be even in worse shape after the hospital closes. Finally, we ask you to enact a catastrophic health care coverage program for all Michigan residents. As you've seen here, health care costs are ridiculously high, and they're highest for those who are sickest. Premiums are highest for those who are sickest. Bankruptcies should not result from a catastrophic illness, and they do result even when people are insured. I participated in a study a couple of years ago done by the Access Project where we interviewed people around 5 different states about whether they'd gone into debt with medical care, and the premise was we wouldn't interview you unless you had health insurance. And we ran across just dozens of people across our 5 states that we studied who had health insurance who went into medical debt because of co-pays and deductibles and premiums that they had to pay. When you have a 20% copay and you need a $100,000 surgery, that's a problem for everybody. Michigan has experienced a program here of catastrophic claims called the Michigan Catastrophic Claims Association. The MCCA has been in existence for 3 decades and has covered thousands who have been injured terribly in auto accidents. MCCA has not only taken good care of these victims, it has been able to be amazingly profitable with a reserve fund that as of last July was in excess of $10 billion. We think the MCCA experience should be looked at carefully as a possible model for a plan for all residents of the state, whether you're injured in an auto accident or simply a victim of a chronic disease and the need for high-end care. We have an analysis of the Michigan Catastrophic Claims Association experience that I did based on records provided by the insurance commissioner in your packet on the left as well. No matter what happens in Washington, there is much to do here. Essential services legislation is needed to protect the most medically needy areas from being damaged further by a healthcare marketplace which is not very forgiving. Hospitals in those kinds of areas sometimes have to close because they can't keep their doors open. We need to protect people in those areas. Catastrophic coverage will make the insurance market work better for Michigan and give us a competitive advantage for attracting jobs. If we have a catastrophic coverage plan for all our workers, there would in effect be a cap on how much private health insurance would have to pay out for each of us if we got sick. Healthcare coverage needs to be secure, and a catastrophic program is the first step we can take here using our experience with the MCCA as a guide. Healthcare needs to be accessible. Essential services legislation ensures some measure of access to all communities. The catastrophic claims coverage, we believe, would drive down regular health insurance costs so that more of us could afford it. We hope we can work together to accomplish these goals. We know a lot's already going on in both houses, both parties, and throughout the state to reform health care. And we hope you find our ideas merit your support. Thank you.
Now it's your turn. We've given you a lot of information, and we've gathered together up here not only Gary Benjamin from Michigan and Michigan Legal Services and Dr. Kevin Piggott. We are also joined by Michelle Debig, who is with the American Medical Students Association. She is in school doing a dual degree, graduate degree, and is very active in legislative policy for the Medical Students Association at the national level also. And we also have Dr. David Green, who is on our Michigan board and is a neurologist. All four of these people have been very, very active in trying to work with ideas for reforming the healthcare system. And we will now, for the next 15-20 minutes, take some questions from you. We've thrown a lot of information at you. Would like to know kind of what you think. And again, those response cards in the packets of the representatives, we aren't asking for your total commitment and signing it in blood, but we are clearly interested in what your response to our ideas are initially. It isn't that we're going to publish your name in the area newspapers and say they agree with us on this. We are trying to see where we are and to take the temperature of the state legislature and to work with people who are interested in working on some of these issues. So I hope that you will fill out those cards before you leave, and we have volunteers at the table who will be willing to take them, and then we will be coming back with you and willing to talk to you more. So with that, do we have anybody who has some questions that they want to ask? And then we want to get you out on time. Oh, we have a shy group. Yes, Alma. I'm sorry, Representative Smith.
I do have some questions on the catastrophic health care plan. Your proposal is that we have a cap on insurance exposure and pay for everything over that with, I imagine, state dollars. What is the exposure above the insurance company's cap? And then my second question is this the most effective way for us to spend state dollars? How many people who suffer catastrophic illness are not covered by Medicare, Medicaid, or other mechanisms?
Gary, you want to take that one, or anybody else?
Okay. I'll start going backwards. A lot of people are not initially covered by Medicaid or Medicare when they have a catastrophic injury. They're privately covered. And in order to get catastrophic coverage through Medicaid, they have to impoverish themselves, which leads us into the bankruptcy situation. So that's why I think it's needed. I think some of the funding can end up being through Medicaid and matched by the federal government. We do not have a hard and fast proposal about where we want the cap to be. How much would be the top? Whether it's $15,000 or $25,000 or $35,000 a year is something that I think we need to have studied by the House Finance Agency here to let us know what that is. The idea is to put a cap on it that would be low enough so that we would have substantial savings in the private health insurance market, but high enough to still merit the word catastrophic, I guess. And as we cover more and more people through the catastrophic plan, I would see squeezing the costs more and more down so that we have cheaper and cheaper regular health insurance, and at some point we're hoping to reach insurance for everyone through this mechanism. So I don't know if I've answered all your questions because I can't, but that's the idea.